My name is Mei Fu. I'm a professor of nursing, and I have been here actually for 16 years since I was assistant professor. I just moved to Boston College in September. I have done about like 20 studies about lymphedema at this institute. So I'm not sure, did some of you participate in our study for like a measurement of the arms and those things? So, oh, you did. Thank you so much. Yeah. And some of you also might also participate in some of my interventional studies. Basically, we use lymphatic exercises to help people to relieve their lymphatic pain and also try to control their swellings. So I'm still here, and we still have like one studies which we need to have a 600 patient. We have a 600. We have a 555. So we still need to have a 55 patients. So if some of you are interested and you get a flyer today, that'd be great. But by now, because we don't have that much patient here today, I would love to just for you to show hands, and so that I know who what kind of situation you are, so I can gear my lectures towards your situation. So how many of you are breast cancer patients? Okay. How many of you are other like a head and neck? Oh, okay. And what other cancers? Head and neck, prostate. So what other cancers you have? Okay, very good. So today I'm going to talk about current science on lymphedema. Like a lymphedema for a lot of years before. In 20 years ago, we really do not know lymphatic system at all. We don't even know lymphedema at all. So, but today, in the past 10 years, everything is really changed. So I want to show you, this is my teams, and some of your doctors are there, and also I have statisticians and also have different people on my team. And those are the major grants that have been done, and the majority of all the studies basically occurred here at NYU Cancer Center. And now the other, this is the ones we really have, we need to have a 600 patient, but we only have 55 patients. Lymphatic system is so important because it's a part of our immune system, right? Because every bacteria and viruses, cancers will go through the lymphatic system first. And in your lymphatic systems, and when they see all those cancers and viruses, they will activate the lymphatic system, have what we call a macrophage. It's like basically a killer cells to kill all this virus and bacteria. And also the lymphatic system is important for regulate our fluid levels. So originally we think lymphatic systems will really just remove 10% of our fluid, of our body fluid, so that it's regulate our body fluid. And so if we have surgeries and we have some lymph nodes removed, and we also have some of the lymphatic vessels removed, and so your lymphatic systems is kind of interrupted. Even if you have a head and neck cancer, prostate cancer, even melanoma on any places, if you have an incision, you are interrupting your lymphatic system because your lymphatic system is superficially underneath your skin. So this is why you might have a temporary swelling. Sometimes the temporary swelling will go away is because your lymphatic system basically compensate a lot, right? So that's also why you don't see lymphedema very rare. You see lymphedema come 1 second. You see after 1 year or 3 months and 6 months, you say why this part of neck is kind of huge than this. Why my arm is a little bit bigger? Why this leg is a little bit heavier, right? So it takes a while because your body tries to compensate first until it cannot compensate. And also, that's also why exercises is so important for all of us. Because when you exercise what you do, you gasp, right? Because then you have a deep breathing. When you have a deep breathing, what happens? You stimulate your lymphatic system. And when you stimulate your lymphatic systems, what happens? You enhance your immune, you help your fluid to go away quickly, right? That's one thing. That's why nice deep breathing, it's important for us. Second, we all know exercise is good. It's because when we exercise is what we do. We move our arms, we move our bodies. While we move our arms and bodies, what happened? We create the muscle pumps, right? When we create the muscle pumps, what's happening? And you basically help the fluid go into the lymphatic system well. And actually, you decrease, you enhance your lymphatic system, you decrease inflammation, and also you enhance your immune system. So that's why it's good for all our cancer patients who will do exercises, because really will help you to enhance your immune system, help you to prevent recurrence, and you will also have an overall great mood, because of in a lay language, you really detoxing yourself with that. So this is our older understanding of the lymphatic system. This understanding of the lymphatic system still holds true. It's still main thing we understand. However, now we understand, our understanding of lymphatic systems get a much more larger, So there's one functions, there's one functions in our body is called vascular endothelium, means skin-like, right? Glycocalyx layer. So it's this layer. Glyco means sugar, like the sugar layers. So this one is called what we call the GEL. It's called the vascular endothelium glycocalyx layer. So GEL layer is almost like this. And before, we only think there's only 10% of the fluid will go through the lymphatic system. Now, with the findings, we know there's 100% of fluid. First, will go through this GEL layer, and then when they go through this layer, and will pushed back to the lymphatic system, So it will not go back to the veins. It will go directly to the lymphatic system. And because of this, and actually, the nail is very important, because when we have a high fat diet, and when we have a diabetes, and when we have infections, when we have a colds, those little projectors here will shade. When it's shade, and more fluid will accumulate it in the veins, and also will not go to the vein, and will go to the interstitial between the cells. So between the cells, and then that's why we started to have all these swellings. So with our understanding of the GEL nail, basically we are kind of really understand now, lymphatic system is not just 10% of the fluid. It's basically 100% of fluid will go. And we also understand this layer is really help us to keep the inflammation down. When this layer is when this layer is damaged, impact, and that's why our whole body are inflamed, right? So with this understanding, and we basically really know it's important to take care of our lymphatic systems right now, right? So, and we talk about what is a lymphedema. And, in a lay language, it's basically the swellings on any of the, I cannot move because the gentleman says he's making the tape and I have to stay in this one. So I would, for example, with the breast cancer patients, usually it's the arm lymphedema or trunk, like here, your breast your back, right? With head and neck cancer patient, usually it's your face, your neck, right, and your shoulders. And with prostate cancer patient, usually it's your abdomen, your tummy area, and your lower extremities or your low extremities. And also even with the melanoma patients, if it's on the leg, usually will go basically to your leg, right? So basically the lymphedema is basically because of the cancer treatment, radiation, we're basically toughening the lymphatic vessels, and also we're also toughening the lymph nodes, because the lymph nodes is important to push the fluid in the lymphatic system. And so cancer treatment is important. I always tell my patients, remove the lymph nodes, remove some of the tissues which has a cancers around your place. It's important. There's no alternative for that. And the research still shows with solid cancers, surgery is still a primary treatment and ensures more than 5 years of survival rate. And for breast cancer patients, actually, we have been achieving to 98% of the 5-year survival, right? And I think for the other head and neck cancers, you're also achieving to 70 to 8, almost 70, between 70 to 80% of the survival rate. So what I want to say, don't be afraid there's some side effects come along with the cancer treatment, because we can help to take care of that problems, later on. So swellings because of the because of the cancer treatment, a lot of times is because the inefficiency or dysfunctions of lymphatic system, which is what we call lymphedema, right? Lymphedema. And the cancer-related lymphedema, basically with breast cancer right now, because we do a lot of sentinel lymph nodes biopsy, so it is around like a 20 to 40% of patients will develop lymphedema. But for other like gynecological and also head and neck, you might have a 20 to 40%. And for the melanoma patients, we probably have more than 60% of them to have a lymphedema for that. We talked about when you have swellings around, right? And basically locally with the swelling, and you have all those inflammations. When you have inflammations, you will have all those symptoms, different symptoms. So for a lot of our patients, a lot of times you don't see the obvious swelling, right? But you feel like my body just aching. My body just feel heavy. My body is just not my body, right? And I feel my legs are swelling, and my legs is kind of puffy around, and I cannot even move my neck, those things. Because a lot of times you don't see obvious swelling, but symptoms comes first, because those are inflammatory symptoms. So if you're looking at all the symptoms, like, the upper ones is like limitations of the mobilities. I'm a little bit focused on the upper ones is because of the head and neck cancer patients and also breast cancer patient. So if I'm working with the prostate cancer patients and melanoma patients and gynecological patients, I would focus on the mobilities of their lower extremities, right? So usually the first sense you find is like, I cannot move my arms. I cannot even roll my shoulders. My arms are heavy and firm, but I don't know, it's just that dull aching pain there. That's when you already have a fluid accumulated, but we just cannot measure it. We just cannot measure it. And when you're looking at all those symptoms and we list it by our patients, basically majority of them are all inflammatory symptoms, because our body are inflamed, So for all of you, I would say, know your body. Know your body. If some like symptoms comes, and thinking about it, and you can talk to your doctors. And for breast cancer patients right now at this building, we have a much better systems right now to get you treated right away. And like what I said, even if we do research, but we also do a lot of free services for our lymphedema patients to measure their arms, to check their symptoms, so that we can get them a baseline. So you know what levels you are. So when new symptoms comes, you can report earlier. And also we have a great RUSC physical therapists. And usually they are very good. So the early you go to them, the better you are, And I would say that for the head and neck cancer patients and the lower, like a prostate or lower extremity cancer patients, the earlier you go, the better you are. For breast cancer patients, the earlier you go, you might also reverse every swellings. As long as you do some self-care every day, you will be reverse all the swellings. So know your body. Try to understand the changes in your body. For that, you will understand your body a little bit more. And so all the symptoms I want to see, there's a different symptoms, and we try to get like a clusters. Because when you're looking at the symptoms, we have so many symptoms, right? You might want to say, I don't have all of them, but I have some of them. But what you can tell yourself, for example, if it's just a mobility problems, lower, you need to make sure if you have some limitations on the mobilities, either at your neck, at your arms and your legs, you need to let your doctors know and let them refer you to the RUSC as soon as possible. Because once the mobility is impacted, there's more problems. Second, we say there's a fluid accumulations. And though for those symptoms, you also need to get treatment earlier, because the earlier the manual lymph drainage comes, and the better your swelling will be really controlled. And remember, we also have like an endothelial glycolex layer, right? The more you get the fluid moved from the interstitial place between the cells, and you have a more GEL layer help you, so you will decrease more of the inflammations, So that's why. And the pain actually is another inflammatory markers. So anytime you have a pain, you need to really report, because chances are you might have a local inflammation, or you might have exacerbations. And for breast cancer, for all the cancer patients, I always say, know your body. If you for a long time you never had a pain, all of a sudden you have a pain, you don't feel good. The first important thing is to do what? Check you do not have a recurrence. Once you do not have a recurrence, every other things is easy to take care of, right? So that's also a lot of times the pain is also another way to show that there might be a recurrence. And for breast cancer patients, local swellings on the arms and local swellings might also indicate recurrence too. So that's why whenever we have these three big categories of the fluid, what we need to do, we need to let your surgeon, like your oncologist know, to rule out there's no recurrence first. And then we will be able to help you to manage all those symptoms. Once your goal is basically to have no symptoms in your body, okay? Once you have no symptoms, that means to say your body is doing well, everything's fine. And I also want to talk a little bit more about, the firmness of the skins or tightness of the skins. Here I'm talking about arm, but I'm talking about firmness and tightness, and especially for the male patients and with other cancers. This is what, and when your skins become like a rough around your incision side and a little bit swelling, very coarse. That's what we call the fibrosis. Fibrosis occurs when you have a fluid around those parts or around your arms, and being there for a long, long time because of the inflammations, and it also because the GEL layers could not work, so create a more local inflammation. So the skin become fibrosis, like a fibrex, like a very tough. And then that's when you really also need to make sure you go to the physical therapist, because then they can teach you how to do some manual lymph drainage to drain the fluid, and also put some of the great lotions on. And we also did some studies on laser, try to break down the fluid, and works well too, and which I will show you some of the studies we did. So especially for the head and neck cancer patients, and because of the fibrotic tissues, a lot of patients cannot even move their necks that much, and they even impact their chewing, eating. So, but for breast cancer patients, if around your breast you find like your skin become coarse, really need to go and to get some manual lymph drainage and do some self-care to help yourself to get rid of the fluid. Okay? And I also want to share with you the updated science. It's like a long time ago, we only think like a primary lymphedema has a gene, have a genetic implications with it. So the studies we did this here at the cancer center, actually we found out there's some genes really related to lymphedema. This study was conducted is because in 2009, when I finished my third study and I tried to looking at what are the risk factors for breast cancer patients getting lymphedema, and I cannot find it because everybody says remove lymphedema or remove the lymph nodes is the risk. But my data shows me people who have one lymph nodes removed had a severe lymphedema. And I also have a patient who have 34 lymph nodes removed and she's fine. Everything's okay. And I could not even figure out. And then the literature really also have a conflicting findings. Sometimes people say numbers of lymph nodes removed will be a problem. Some people say no, with no problems at all. There's no correlation. So I was thinking about maybe there's some genetic, and especially lymphedema is inflammatory. So I did this study. What I found, interleukin. So those are the inflammatory genes. Interleukin-4 is basically related to if we cannot move our arms, and also if we have swellings. And then we looking at there's a interleukin-6 also is a very important inflammatory genes and connected to pain and everything, and connected to obesity, and there's two segments of interleukin-4. They're all related to swelling. But what importantly, and the pain, and the VEGF-C is basically a lymphatic gene. So the lymphatic gene and also inflammatory gene interleukin-13 are related to pain. All of a sudden explains every mysteries in my patients, right? So that's why when you ask the doctors, what is the chances that I can get a lymphedema? Why I only have one lymph node removed, I'm so miserable. You might have that gene. So I also want to take a look and say, for example, we have this fluid accumulation, right? There's 3 genes involved in that fluid accumulation characteristics. So I wanted to say if a patient just have one gene involved, what is risk for them? If they have 2 genes involved, what is the risk for them? So what I found, if a patient just have one gene, either interleukin-6 or interleukin-4 on different sections, and they only have 2 times a risk to have a swelling. However, if a patient have 2 genes involved, their risk is doubled more. It's like almost like a 6%, 6 times of the risk. In our cohort of our patients, we did not have anybody involve 3 genes. But if we do another study with a huge number of patients, we might see some patients have 3 genes involved, And also, another mystery with me is like we have a patient only have a lumpectomy, not even, when I say lumpectomy, it's like just a small sections of breast removed, right? And some of our head and neck cancer patients have a small lumps removed. And I have a patient who have a double mastectomy, double breast removed. They are fine. When you ask them, I'm good, I don't have any problem. But with the lumpectomy, like a small portions, I'm so painful, I'm so bad, I don't feel good, I cannot do anything, I need pain medications. A lot of times, we all have a bias to say, wow, whether this is real or not. Looking at my other patient have the similar surgeries, they do not have a problem. But this study really resolve the problems. So if a patient have a 1 gene, either VEGF-C or the interleukin-13, the risk to have a pain is 2 times than average other patients who do not have a gene. However, if they have a 2 gene involved, what happened? They have a 12 times of a chances to have a pain. Yes?
Do the pain genes also affect the swelling? Or
yes, they're all together. Yeah, they're all inflammatory genes.
Have they been looked at in terms of chronic post-mastectomy pain syndrome?
Actually, they did. And so the pain is really still belong to inflammatory part. That's also why the new theory of the lymphatic systems is because we cannot push the fluid, right, in a right place. They are sitting in the interstitial, even if we don't know where are they, and they are still inflammatory. So like also, just thinking about it's a common sense, right? When we cut our fingers a little, what happened first? You have inflammation comes first, and then you have a pain, right? And once the inflammation is done, and then your pain is better, right? And what this research tells us, we might be able to identify patients even before surgery. So if we know they are genetically predisposed to swelling, we can teach them some lymphatic exercises they can take care of themselves. And for people who has a pain, and actually we can even give them more pain management right after surgery, so to control their pain, because research also shows if we help patients to control their pain right away after surgery, the chances they have a chronic pain is less, And we can also teach them lymphatic exercises, which will decrease their inflammation, and also will also help their pain too. And I will later on will share some of the results from our study to show you what's going on with that part. So those are the new science, we know. And also, it's important for us to understand you cannot compare your neighbors with you, right? You cannot compare because it's so different right now in terms of cancer treatment, and also in terms of side effects and quality of life. Each patient is so different, right? So I also want to talk to you about another science, and you all heard about artificial intelligence, right? Everybody hear about artificial intelligence. For you, all of you, what do you feel like when you see artificial intelligence? All of the things you're thinking about is like a robot is picking up things, jumps, rolls, and carry things. However, at this cancer center, we also have a project which is also use artificial intelligence. When we use this artificial intelligence, because we know all those symptoms are precursors of a measurable lymphedema. So we try to use the symptom assessment to use artificial intelligence to see if we can early diagnosis with patients so that we can intervene earlier. So this is one of the studies which I was talking to you guys. We need to have 600 patients. Now we have 555 patients. And I want to show you a little results of this. So with the artificial intelligence, and we can basically diagnose patients with 93.75 accuracy, whether they have a lymphedema or not have a lymphedema, And we also have a 95% of chances to diagnose patients who had a lymphedema, and we have a 91% of chances to diagnose who do not have a lymphedema. This is much, much higher accuracies than your doctor to take a look and say, how many of you, like you say, I don't feel good, I feel like my arms are heavy or swelling, and your surgeon said, I don't see the differences. He said, I do see the differences. I used to have an indentation here, but I don't have. No, I think you're fine. But this is better than your doctor was talking. But this is also very easy. So what you do, I hope like some of you was participating in our early study, like when you come, you get a little tablets and you put all your symptoms in. Any of you participate in that study? Yeah. Oh, so you did, right? Yeah, you did, right? Great. So basically, this is so for next year, what we want to do is like we want to disseminate this algorithm on the website, so patient basically can put all their symptoms and their relevant some of the medical informations, and then it will tell them, say, oh, you're good, you can just enjoy your life. Right? And then you might have some risk of a fluid accumulation, you need to do this lymphatic exercises. Or say you need to go to your doctor immediately to see your doctor immediately. So even if you are not within the timeline to see your doctors, you can still self-monitor yourself and give yourself some of the reinsurance and also give you some guide. So this is another, in the next 4 or 5 years, you will see this as a package. Hopefully, we will be able to talk to the insurance company, and so the insurance company can cover it for all the breast cancer patients. That will help them, because lymphedema is not like a 1 year or 2 year, it's lifetime. One of the oldest patient was an 86-year-old in our study. She's so cute. She told me she had her breast cancer when she was 30. She told me, she said, Dr. Fu, I did not even remember I had a cancer until this year I had my lymphedema. For years, we don't even know because people do not survive this long, right? But now people survive long. All of you will survive to 80, 90, right? And those other things can occur anytime. But if you know there's artificial intelligence, you can at home put in your information that tells you whether you need to worried or not worried. That's so powerful for you. You are empowered to take care of yourself, right? So that's another thing. In the next few years, you will see the artificial intelligence and also healthcare at fingertip. You can do that at home. You will also see that too. You don't need to come to see me, or you don't need to come today. Actually, in 5 or 10 years, you don't need to. I want to share some of the results, and some of you probably already in this study. This one is like we're really looking at a chronic lymphatic pain. Basically, we're looking at the pains for breast cancer patients in their affected arms. I would say lymphatic pain also related to head and neck cancer patients, because all the pains there, and oral pain and your throat pain and the lower extremities have the same symptoms as the breast cancer patients for the upper limbs. And I want to share with these results with. So we had 283 patients interested, but there's 163 patients not eligible. And we also, 145 not eligible, they did not meet the inclusion criteria, but we only had 18 patients did not want to participate, and which is wonderful. And we have two groups. One group is what we called lymphatic exercises. Another is arm mobility exercises. And we only have a 6% of the we lose the follow-up, so which is great because usually breast cancer research is 20% attrition. You were lost to follow, so we are very happy with that. But I want to show this to all of you because it's you who are moving the science forward. It's the patients who participate in those studies who are moving the science forward. So you have a power. You do have a power for moving the science forward, And so the results, what we found is like for lymphatic pain, we have a significantly more people really, like this is a lymphatic exercises, this is the arm mobility exercises. And for the pain, actually, we have more people in the lymphatic exercises, pain-free. And we have also in the lymphatic exercise ones, we have more people have like a sore free. So like we also look at the sores, arm sores, and we also have aching, But what happened is so funny. So for achings, the arm mobility actually at the very beginning is the same, But then later on up, is the tenderness, and we do not understand. The reason, and we ask our patients, say, like tenderness and basically the arm mobility exercises help like steadily. But with our lymphatic exercise patients, in a second month, they have more tenderness. And I ask them, say, why all of a sudden you have more tenderness? You know what the answer? They said, I feel so good about it, so I started to have weightlifting. And then because they feel so good, and they did not start with 1 pound to do 1 month, 2 pounds to do, they just went through like 15 pounds, 5 pounds. So I always tell my patients, when you feel so good, when you try to start something, always gradually. Don't overdo it. So what this help us is basically the lymphatic exercises basically help our patients much better dealing with lymphatic pain. And Dr. Van Cleef, who is researcher on head and neck, who is sitting behind, you can wave to everybody, who does study for head and neck patients. I was talking with her saying, we should really pilot this study to the head and neck cancer patients because it can help them so much with the lymphatic pain. And we're also looking at the general bodily pain. So we found actually the lymphatic exercise patients really have a much more better general body pain. But this is also understandable because once you decrease your inflammation, your general bodily pain will also improve. Not only just in that area, the whole body, because the lymphatic exercises was designed to really strengthen your lymphatic system, so which is really focused on decrease your inflammations. So that is the one really, and I'm very happy for that results, so I'm happy to report. Another studies is like we use the low level laser, and which is also happened here. And one thing, for the laser studies, a lot of times people don't know. So how do we know it's a laser or not? So we worked with the industry. We have the 2 shank lasers. So basically, they deliver nothing. They just don't deliver anything. That's why. And the therapists did not know which one is real, and the patient did not know which one is real until we finished the data analysis. And then we reviewed which group has laser, which group does not have a laser. So that's the strength of this study. So what happened is, so we had breast cancer patients and who had a lymphedema, and we basically developed this grade, and then so we gave them the laser treatment every time they come to the clinic. And we have a different color, so we have a red, green, yellow, and brown. It's because we don't want to overdose one place. So every time we will take different colors so that we will make sure there's always half inches between last time treatment and this time treatment, And for this one, it's a little bit harder for us to recruit because we only take patients who are going to have what we call decongestive therapy. Like they have to be wrapped for 6 weeks every day, and they have to basically it's wrapping. They hate it, So not everybody wants, but we still did recruit 11 patients in the study, and which we really think about. So for the laser ones for the group, and what you will see, basically people in the laser group, they have less symptoms. They have a more like a symptom free, and also they also have less mobility symptoms compared this two. And although their fluid accumulation did not have any differences, but those are the patients who have a severe lymphedema. So like I do not expect them to have that much, but their pain is really relieved, And also their sadness is tremendously relieved. And the patient will say, I feel much better right now, and I feel like I have a future because I can do something I can manage it right now. Before they say, I don't know if my arms are going to be this big and what I'm going to do. Now they know it can be controlled. So that's the emotions really getting better. And also they feel like their self-perception is much better in the laser group because their arms is getting better. They don't have a pain that much anymore, and they feel like overall they feel the body image is much better. And like what I said, the lymph volumes, how big the arms did not change. However, you also find out the active patients are more adhere to what the clinicians talks, and it's because they feel better, because they wrap their arms more better. And so this study and actually makes sense to us. So maybe another study is like we can have a patient who have a traditional wrapping methods, maybe have a patient to just have a laser and see, right? If we still have the same effectiveness, and the patient don't need to wrap their arms all the time anymore, which is another great thing for us. And what happens, and all those symptoms actually be relieved, makes sense to me. The reason is because when you have a laser, it breaks down the fibrotic tissues. Remember what I said, the fibrotic tissues is tough and strong, right? And so when the laser comes and block the fibrotic tissue and then move the fluid back to the lymphatic system. So that's what happened. And so I also want to talk a little bit more about, because in this New York City, you have heard a lot of people talking about surgeries, right? Oh yes, if you have surgeries, you have to. So I want to go over with you what are the current surgeries we have, and in what conditions people should think about surgery. Okay, so when surgery is what we have heard, like a lymph nodes transfer, right? Basically, what happens? People will, if it's a breast cancer patient, they will move either your growing area lymph nodes to the upper, Still, we really still do not have a good study to show the effectiveness of it. And people also worry about people will develop a lower extremity lymphedema because it's harder to treat when you have a lower extremity lymphedema. So when you want to do the lymph node transfer and really ask your surgeon which part of lymph nodes they are going to transfer. And I would be cautious if it's from the tummy or from the groin area, because the chances are you might also have a fluid in your tummy later on and in your lower extremity. So I'm not sure if I'm the patient, right? If I'm the patient, and I would choose it later on until I have a huge clinical trial to support, or even just like a long-term, maybe like a long-term outcome, like a patient who have a surgery 5 or 10 years out. I would see that and see if there's other problems with their other part of the body. And then there's this another like a lymphovenous bypass. Basically, it's try to connect lymphatic system to the venous systems and try to push the fluid into the venous system, into the vein. So, and you all know the pressures in the veins, it's still higher than the lymphatic system, right? So there's a chances the fluid in the veins will backflow to the lymphatic system. But also right now, when you see the new understanding with the endothelium, galaxy, lattice layers, and actually you should worry about whether this works or not. And also this one still hasn't been have a long-term, results for it, for that part. And then you have a lymphatic bypass. And this one actually might work. So some of the surgeons right now, especially, I do not know about, because I'm not directly work with the head and neck and also melanoma patients, and also the prostate cancer patient or GI patient, I do not. But for breast cancer, I know the surgeons here in our institute, and actually they try very hard to bypass. If there's no cancers surround the lymphatic area, they don't cut it. So which is wonderful. So they just bypass the lymphatic system. They try to make sure they don't cut the lymphatic vessels, those are things, and those ones still very good, so we can still. And then, however, if there's a huge lymphedemas, really your arms is twice, really bothers you, you cannot really live with a very productive life, and it's really impact your life or not, and you might want to thinking about skin tissue excision. So what happens, they will open your arms and basically just take out the extra tissues and fluid. But what happened by the end, if you have more fluid in that area, by the end it's not fluid anymore, it's a fatty tissues. Because once the fluid is there for a long time, what happens is all the tissues become fibrotic, and also all the fatty tissue, fats, basically accumulated there than the other arm. So what happened, and with the excision, is you can take out all those extra tissues, and then try to later on to get some physical therapy and do your own self-care, and you might be able to maintain that arm. And you can also do a liposuction, just don't cut any tissues, but just get the fat out. Get the fat out will also work too. But I would say, like what I said, if we know our body, if we know to report as early as possible, right? And if we get treatment as early as possible, I hope nobody will go to the stage have your arms twice the arm or your neck twice the other, right? And also, I I always tell my breast cancer patients and also my head and neck cancer patients in China, I always tell them, I said, being diagnosed with breast cancer as a turning point of your life. Study to take care of yourself, basically know your body. Take care of yourself, and even healthy people have to do something to maintain their health, right? And then we just need to do a little bit more to maintain our own health. So, and then we are not going to go to the stage we need to have a surgery. We need to have a surgery again. And our future is bright with all the precision medicine, precision with genetics, and with all those artificial intelligence. I'm expecting that with our team, we might be able to develop a biomarker test to say who is at risk, who is not at risk. And we might be able to develop a genomic testing even when people are young, and we say whether they have a risk for lymphatic disease, And most often, we can really use artificial intelligence to deliver our lymphatic exercises to our patients, behavior one. And we might, if we know some of the markers, biomarkers, are inflammatory markers, and we know from the big studies, and we will be able to really looking at pharmaceutical approach, because by now we really do not have any other way to managing swellings, any swellings. With that, I'm done with my teaching. However, I'm here to so that I can answer some of our questions. Yes.
Is there any relationship with lymphedema to increased blood pressure?
Actually, that's a good question. In the summer, we did a one artificial intelligence test study, basically focus on using AI to teach patients correctly how to do the lymphatic exercises, and we measure the patients before and after their blood pressure. Because remember, majority of the blood pressure is also fluid related hypertension, right? High blood pressure. So it definitely, so especially with like a patient who have a fluid overload hypertension, if you can teach them to do the lymphatic exercises, can help them to maintain the hypertension and also the swelling too. And remember, all of them are related to body's fluid system, and the lymphatic system is a huge body fluid system. Yeah. Any other questions? Yes.
Have you ever come across someone with a chemo provoking lymphedema?
Yes. And actually the reason for that is the chemotherapies, and actually is especially with a certain chemo drugs like Adriamycin and those, right?
So the chemo port is on the opposite side of the chest of the mastectomy.
Oh, right.
And it's causing the lymphedema in the non-affected arm.
It will. Remember, depends on which side. Remember, like when you watch the video, right? Our left side have to remove 75% of our body, like a lower extremity, head, and a right side. So if it's the right side impacted, might not have more problems. But if it's the left side have more problems, and the patients already have preconditions we don't even know in their lymphatic systems, and then not only they will have a lymphedema on the other side, they might also have a lymphedema in their legs, in their tummy. So that happens to very few, probably 1% or 2% of patients in that part. And yes?
Are there activities that will exacerbate lymphedema or make it occur after never having it, such as lifting heavy things or?
I would say, so for example, lifting, I always tell my patients, don't lifting over 5 pounds, And the groceries, if you have the plastic bags, you need, and basically it cutting off your circulations, sometimes will also cutting off your fluid and cause. So I always say, use your common sense. If you lifting heavy things, your arms are sore, hurting, less next time, you know. So your job is to make sure there's no symptoms on your arm, on your legs. But if there's a symptoms, you know you need to decrease that weight. Yeah. Go ahead.
What is your view on the sleeve, to wear a sleeve if you have?
My view on sleeve is basically, I feel like early on, I think it's important to train the lymphatic system to remove, because the sleeve only have one function. Giving a pressure to move the fluid. That's one function of the sleeve. So, but if you have already wear your sleeve for a long time, works well, go on, continue to that. But I do have a patient really try to breathing, exercising every day, and they're doing better. They don't need to have a sleeve later on. But you always need to thinking about the mechanism of the sleeve is to put a little pressure to move your fluid. So that's why sometimes other patients feel like, oh my gosh, my arms does not have a fluid, but now all the fluids are in my trunks right now. So a lot of people also think. So I would say if sleeves works for you, go on for it. If it does not work for you, work with your therapist to find another way. I say 2 arms. Yes.
Good evening. I'm a breast cancer survivor. I had a lumpectomy and I had lymph nodes removed. So a couple years ago I was traveling and I belong to several support groups. And someone recommended that I should get a sleeve. I didn't have lymphedema or anything like that. They said, oh, you're traveling and you're going to be compressed and all of that and all of that. So they had me all worried, and I went to the store and I paid $75 for the sleeve. And I said, you know what? Let me call my breast cancer doctor before I put this thing on, because we were struggling to get it on. I didn't have my arm wasn't swollen or anything like that. I said, let me call him. So I called him. He said, okay, is your arm hurting? No. Is your arm swollen? No. So why did you go and buy the sleeve before you speak to me? I said, I don't know why I let them convince me. So he said, you do not need the sleeve, do not wear the sleeve, donate it to someone, go and take your trip. So we have to be careful about messages that we get, because I did not have lymphedema. So if I had put that on with my travel, he said, then I would have created a problem for myself, because it is so tight for me to put on, and then that would have created a problem for me. So since then, I've been telling everyone, check with your doctor first before you go and spend your money on the sleeves. I just donated it. I tell them, give it to someone who comes to the hospital, and if they need a sleeve, give it to them. So what would you say about situations like that?
I think that's exactly I would recommend my patients. Always know your body. If you're doing fine, you have no symptoms in your arms, you really don't need to do anything more. But if you have symptoms, definitely it's a different approach. So that's why I said it's always important to know your body, and always important to report your symptoms to your doctors. And if you call me, I will give you the same advice. Yeah. How about you? I saw you. Do you have another question? Yeah.
Another question.
Right.
So in terms of implants, all of them are surrounded by silicone, and then there was the recent one that they especially put in women who are going to have mastectomy and then radiation, right? The textured implant by Allergan or whatever. So is there any? In terms of lymphedema over the implant and the whole breast area, do the implants cause more lymphedema?
No, I don't think so. I don't think that's the problem. I think radiations always create acute inflammation because, like you will see during the radiations, you almost have a burn characteristics of it, so that's acute inflammation. And during that stage, you definitely will have a lot of swellings going on. And I think you should expect your radiation. I always encourage my patient who already in my clinical trial, who knows how to do the lymphatic exercises, say, do your lymphatic exercises during your radiation because that will help you to control your inflammation, right? But you always remember, implants is also a foreign object, right? Any of the foreign object in your bodies will always cause some inflammation. So I would watch it closely and say 6 weeks after the radiation if I feel better or not. And if it's continue, sometimes if your body really rejects that implant and you need to take it off. So again, know your body, right? Know your body is important. And I think I am exceed 5 minutes, but if you need to go it. But if you have more questions, I will stay for another 5 minutes for all of you. But thank you so much for coming and during this rainy day. And I hope you find this lecture it's a little bit helpful. Thank you. Thank you. Yeah.